From the Toronto Star, I'm Adrian Cheung, and this matters. The bars and restaurants you're thinking about eating at, they're doing it.
Our team members now enter through our front door so they can wash their shoes with a disinfecting solution on this mat.
The gyms you're working out at, they're doing it too.
When combined with increased touchpoint disinfection and our industry-leading cleaning program, this will ensure all of our clubs receive a comprehensive, thorough cleaning every day.
So are movie theaters that have reopened in a few provinces.
Our cast members clean the seats between each showing. Our auditoriums are deep cleaned every night.
In a pandemic, the promises of round-the-clock cleaning and sanitizing of every surface is the product they're selling. But is any of this actually making us safer? Critics of this practice call it Hygiene Theatre, an outward display, usually by businesses, of blasting every surface imaginable with disinfectant to stop the spread of the coronavirus and ensuring us they're doing things safely. We're still learning more about COVID-19 every day, but according to the latest science, surfaces are not the main way the virus spreads. It's most commonly spread through the air, respiratory droplets from coughing or a sneeze or from the saliva of a person talking. Just sanitizing and doing little else doesn't change that. And maybe that's another question. Are we taking away resources and time from the things that have been proven in slowing the spread of the virus? Today, we're talking to Dr. Isaac Bogoch, infectious disease specialist at the University Health Network and Toronto General Hospital. We're talking about hygiene theatre, whether it's a good or a bad thing, and what are the best ways we can stay safe right now. Dr. Bogoch, thanks for sharing your time with us.
Oh, not a problem at all.
So we've been living with the pandemic for almost 6 months now, and there's still so much that we're continuing to learn. We definitely know more than we did in the first several weeks, though. What are some of the best practices we're now using, or at least to stop the transmission of the virus, or at least slow the transmission of the virus?
So certainly we know now where this virus is most easily transmitted, and that essentially is in indoor spaces where there's lots of people congregated in close proximity for prolonged periods of time. When we have those events, those scenarios, it doesn't matter how we get there, but when we have those scenarios, we see more effective transmission. So you can think, what's an indoor event with people in close proximity to each other? Well, you can have house parties, you can have perhaps restaurants or bars that aren't adhering to the fundamental public health principles. You can have schools, you can have a positive person that comes back to a multi-generational home. As long as those criteria are met, we will certainly see expansion and transmission of this virus.
So indoor spaces, lack of physical distancing, oftentimes lack of masks, those are all vectors for transmission.
100%. I mean, when we think that's just where the virus is transmitted, then we sort of think about, okay, what are the strategies we can do to reduce the risk of transmission in those settings? Well, number one, physical distancing is really helpful. Number two, putting on a mask when you're going into an indoor setting can help as well. Number three, ventilation of those settings is appropriate as well. So we talk about air circulation and air turnovers per hour and getting into some technical stuff like that. Number four, we can limit the number of people that congregate together in these settings. Number five, we can ensure that people have access to good hand sanitation and hand hygiene in those settings. So essentially, there's just a lot of different strategies that we can take. Doesn't matter if it's at the home or a business or a school, but there's just a bunch of different strategies we can take to reduce transmission in those settings.
And how has the science changed, especially in sort of the early days of the pandemic? I know some of the general public has said that sometimes the messaging can be confusing, that in the beginning, masks were not required. Now it's standard practice to be doing that when you're outside, or especially if you're going into an indoor space. How has that conversation changed?
Well, I think there's been certainly a much better understanding of this infection and how it's been transmitted as we've learned more about it. And I think it's important that obviously people in not just medicine and public health and science, but of course the lay community stay open-minded. And as we get new data, you might see changes in policy. I think that's smart. I mean, sometimes it gets perceived in the general public as, these policymakers are flipping and flopping and they can't make up their mind. But on the other hand, like, what do you want, right? There's new information, there's new data, and that new data is getting incorporated into new policy. I think that's a smart approach. I mean, you want this to be malleable and you want this to be flexible to stay up to date. I mean, honestly, you brought up the really good issue about masks, right? In January and February, myself included, we were saying, you need to wear a mask? No, you don't. And that's when we had exactly 0 to few cases in Canada. You didn't need a mask then. People were asking the question, will a mask protect me from COVID-19? And the answer is no, it's not going to when you have no cases of this infection in Canada. And B, we have to be very honest with the question. No one was asking in January or February, hey, if we all put on a mask, will we protect each other? We just didn't have any or many cases of this infection in Canada. And then as time went on, and of course, as we saw more cases imported and then we saw community transmission, the question changed, and rightfully so. Of course, it's going to change. The question pivoted to, hey, if we all put on masks, will we prevent transmission of this infection from person to person? The answer is, it probably will have some effect. Now, I know masks, I'm not going to pretend to understand why, although I do understand why, but I'm just not going to get into it. Masks is always, for whatever reason, there's been a very polarizing subject. And I think people just need to take a deep breath in, appreciate that this is like anything else. The extreme views are probably not the most accurate. Masks probably provide some, but not as much as many people think, but provide some protection and some effect. And now, of course, we have across Canada different policies, but everyone either strongly recommends or mandates putting on a mask when you go into an indoor setting. I think it's also important to recognize that there's, on the hierarchy of public health methods to prevent this virus from being transmitted, there's other very important tools. Physical distancing is crucial. I mean, that's extremely important. Of course, if you're in an indoor venue, I think there's a much greater understanding that air circulation and air changes and air turnover is also a very important part. So the ventilation component of indoor spaces is also a rather important component too.
If we think back to the early days again, I know that there was a lot of concern as we were still learning about COVID-19. There's a big worry about the transmission from viruses, fomite transmission. What do we know about transmission from surfaces now?
Great point. So earlier on in the pandemic, we had certainly a lot of concern over touch, and as you point out, fomite as a major mode of transmission. And certainly that translated into different behaviors. So for example, people were going to the grocery store and we saw a lot of people wearing gloves. We saw a lot of people wiping down every single item that they purchased at a grocery store. We saw people leaving mail or packages delivered outside for a couple of days before they'd bring them into the house or washing them down. And, as time went on and as we had a greater understanding of this virus, I think it just sort of gradually became clear that that's just not a main mode of transmission. It is a mode of transmission. It's just not a significant mode of transmission. So I wouldn't want to discount that altogether. But on the other hand, it looks like the vast majority of cases are transmitted through what we call respiratory droplets. I'm not sure if we want to go down this path, but there's been recent debate about, is this airborne or droplet? And again, I think it's pretty safe to say at this point in time that the vast majority of transmission is through respiratory droplets. Yep, there certainly can be other modes of transmission, like we just touched on, but, close proximity to an infected person for a prolonged period of time, especially in an indoor setting, that's how most people are getting this infection.
And to your point, again, rare doesn't mean impossible. Obviously, that's why doctors such as yourself are still saying you need to wash your hands, you need to sanitize what you can, especially high-touch surfaces. These are still important things.
Oh, yeah, 100%, 100%. I mean, hand sanitation's important. You know what? If there's any lasting legacy from this pandemic, which there will be, I hope people wash their hands more. I mean, think about some positives we can take out of this. That's fantastic. If people have a little hand sanitizer in their car or at the front of their house, or, you see grocery stores or gas stations have it available, that's great. I'm all for that. I think it's fantastic. Now, are we going to hand sanitize our way out of this pandemic? No, we're not. But it's a component, and it's an important component of staying healthy and of preventing infection.
It helps. It helps.
Yeah, it totally does. But, to your point, do you need to wipe down every grocery item and wash your fruits and vegetables with soap and water before you bring it into the house, before you eat them? I mean, in general, I think the answer to that is no, and I think we've known that for some time. Having said that, we use the term hygiene theater has been used to describe that.
Can you define that?
Yeah, I don't really have a good definition. Yeah, I mean, sometimes it's sort of defined or at least understood as either companies or organizations or individuals taking extreme measures to do deep cleaning and to wipe down every surface possible to really provide a level of safety or a level of protection to others. And, I think there's a few things to say about that. One is that, as we sort of just chatted about, yeah, you got to wash your hands. That's important. That's very important. And, number two, it is also important to wipe down high contact surfaces. I think that can be very helpful. But this is more of a to what extent question. And these extreme deep cleans and every square millimeter of every surface cleaned down at some interval, at the end of the day, it's probably not adding any incremental level of protection that's meaningful. And we know that now.
We'll be right back. So is it sort of marketing on their part of selling us the idea too that they are taking precautions, which of course are important, but I've seen this written as well that it's kind of a waste of time in what is fundamentally not how this virus spreads?
I think there's a few points there. One is that wiping down high contact surfaces, no one's arguing that that's a bad thing. We all should be doing that. That's fine. Washing your hands, we're all agreed on that. Taking it to another level, yeah, again, it's probably not adding any incremental level of safety or protection, but it probably does a couple of things. One is it signifies that perhaps companies or organizations are aware of this virus and are taking it seriously. Now, is it a waste of time and money? Yeah, maybe. If they're using other precautions like physical distancing, like handing out masks at the door when people come in if they don't have one, like, really adhering to the other fundamental public health principles. I think the other important thing is we have to remember that some people are continuing to do this, and that is just fine. For some people to get through their day, they might really feel the need to wipe down all their grocery items. Fantastic. Go for it. If that's what helps people go to the store, get food, provide for their family, make it through their day, I'm all for it. I'm not about shaming and blaming. We are all perceiving this pandemic in our own way. We all come at this with our own unique risk thresholds, risk perceptions, risk tolerances. And again, personally, that's not my practice. I just go to the store, buy what I need, take it home, put it on the shelf, wash my hands and go about my day. And that's what's good for me. That might not be good for other people. And I'm totally okay with that. I'm totally accepting of it. I completely appreciate that this might be helpful for other people, and kudos to them. Carry on, carrying on. Because at the end of the day, poking fun at it, shaming it, blaming it, pointing out that it might not be adding incremental value, I'm not sure if that's really helpful. And, I think you never really know what's lying underneath the hood. And it might be those behaviors or those traits that are really helpful to people. So they might be doing it personally, or when they hear of other companies or organizations doing it, people might be more willing to go to those places and, get along with their day and carry on with their lives. I think that's extremely important. And this often gets lost in the conversation. We often stick with science, data, but there's a lot more to this than science and data. And I think the psychology behind this, especially when we factor in the other traumatic things that have happened through this pandemic, people, it's taken a tremendous psychological and emotional toll on people, of course, a health toll, a financial toll. So if this helps people get through their day, I'm all for it. I guess with the caveat that, listen, if a company's doing this or an organization's doing this, as long as they're adhering to the other fundamental public health principles like physical distancing and handing out masks for people in indoor settings, as long as they're doing the other stuff, I honestly don't care. I'm all for it.
Right. And to your point, There is the mental health aspect of this, of people just trying to survive the pandemic. If this helps them and it's not distracting from anything else, it's not entirely a bad thing.
Home run, total home run. And like anything else, it's a balance, right? Like if this is taken to such a degree that it's interfering with their lives, where they're spending 18 of their 24 hours a day wiping down every square inch of their house, okay, obviously that's at a far end of the spectrum and people really need to seek help because it's probably interfering with their other aspects of their day. So like anything else, there's a balance. It always comes down to what extent are people doing this? But if people are just saying, you know what, I just need to wipe down my groceries before I put them in the shelf, okay, fine. If it's not really affecting their personal habit, their personal life, their occupational life, their social life, then I think it's totally fine. When it starts to impede on other aspects of their life, I think obviously it might be more of a problem and people need to have that looked into.
When we zoom out on the topic of hygiene theater, especially when it comes to businesses, I've seen some of the critics saying that there are downsides to this. This idea in public health about prevention fatigue, that if everything is a priority, then the public just begins to block it and not listen. Do you see any downsides to companies, not necessarily people, but companies engaging in hygiene theater?
At the end of the day, probably not so many. I really don't. I mean, I get it. I totally get it that if it detracts from other fundamental public health principles, then it's a problem. But if it's happening and it's not really taking away from anything else, and it's not completely over the top where it's going to, as you point out, cause pandemic fatigue. I mean, I look at it, I acknowledge that this is probably excessive. My personal bias is I just don't care. I just don't care. Like, you know what? So be it. People are going to do what they do. As long as it's in a reasonable spectrum of behavior, fine. If it falls outside what I personally consider reasonable and is overly excessive, okay, it's annoying, but so be it. And of course, everyone's going to have different goalposts of what they feel is reasonable versus excessive. This is clearly a sliding scale, but personally, it just doesn't bother me. In all fairness, I'd rather people acknowledge this pandemic. I'd rather people take it seriously and adhere to public health principles rather than the opposite end of the spectrum where they ignore it, they deny it, they politicize it. So I'd much rather have this than the opposite, than the counterfactual.
So golden rule is there's nothing necessarily wrong with it as long as you're doing all the other things that we know help slow and stop transmission, like distancing, like masks, like sanitation. It's all part of the whole ecosystem that we're all figuring out right now.
Yeah, that's my opinion. I mean, I'm sure that if you lined up 20 people in infectious diseases, public health, epidemiology, public policy, everyone's going to have a different opinion. I just think it's interesting how the pendulum has swung from excessive deep cleaning. And again, we didn't know any better then. And then it really swung far toward the other end of the spectrum with people sort of pointing their finger saying, you don't need to do this, and this is ridiculous. Like, hey, everyone take a deep breath in, calm down, it's okay. Not a huge deal. Maybe it is excessive, but as long as it's not detracting from other fundamental public health principles, as long as people are taking this pandemic seriously, as long as they're doing their best to get through their day, I'm personally okay with it.
Dr. Bogoch, you specialize in infectious diseases. Has it been challenging these past few months, figuring this out for yourself too, of what best practices are, but also helping educate people? Has that been difficult? Maybe a loaded question. I don't know.
Yes. Yes. Got an hour? Yeah, no, of course. I mean, honestly, many of us who work in this field, we have a lot of jobs, right? Like take care of a lot of patients in the hospital. We got a lot of patients in our clinics. I work in an academic institution. I'm supposed to be doing some research that, of course, ground to a halt because of the pandemic. We've got teaching roles, and then some of us have been asked to speak publicly, either to public forums or on the media about this. And of course, you want to keep your head above water and have a social life, well, whatever that is nowadays, and remember what your wife and kids look like from time to time too. So there's a lot of challenges here. And of course, trying to stay as up to date as possible, stay on top of all the newest research and all the data that's coming out, which is now coming from a variety of sources. And then of course, as with anything, there's going to be a lot of misinformation and pseudoscience that's being peddled and amplified from various mediums. So I got to try to stay on top of that and at least keep my hand on the pulse about what's being discussed publicly about this. Just try to stick with the data and try to stick with the science and try adhere to fundamental public health and scientific principles along the way. And yeah, I mean, it hasn't been a walk in the park, that's for sure. But on the other hand, I mean, we get through, we manage, and been obviously exhausting, but also fascinating at the same time.
Yeah, your job has, from a general public's point of view, has never had more focus. People really want to hear about, bacteria and germs and infection. They want to hear from you.
Yeah, I think it's fantastic. I mean, listen, if we have a health literate population, that cannot go wrong. Like people who are asking good questions, who have genuine curiosity, who are integrating some of this information into their day-to-day lives, that's fantastic. And we can get young kids, boys and girls from a young age interested in science, medicine, public health, policy. I think this is fantastic. I mean, I'm totally biased here. I'm completely biased, but I like it. I think it's fascinating, and always happy to chat about science, medicine, public health, epidemiology. I'm a total nerd, but these are interesting to me. And if this gets individuals, I'm not sure if we want to take it down this path, but certainly we've seen how this virus has disproportionately impacted certain communities, immigrant communities, low-income communities. And hopefully, I mean, it's hard to find silver linings in a pandemic, but there are a few. And perhaps this will help stimulate a lot of positive commitments to funding for equity and health outcomes in many of these populations. And, maybe there's a child who spurs their interest and they go into this field as well. I mean, there's a lot of positives that can come out of this. Of course, we're well aware of what the negatives are, but there certainly are some positives. But it hasn't been an easy few months, that's for sure.
Last question. I wanted to circle back to a point that you made earlier. How do you think hygiene theater, whether it's from businesses, deep cleaning, or our understanding about sanitation, how do you think that's going to change our health practices, our sanitation practices from now on? I think about, for instance, a major event like 9/11. That fundamentally changed the way we travel. How do you think the pandemic will change the way we approach cleanliness and health and sanitation and all those things?
Yeah, I think there probably will be a lasting impact at some point. And I wouldn't be surprised if we see a few things moving forward. I think number one, in grocery stores or gas stations or big public businesses, I wouldn't be surprised if we see a hand sanitation station at the door. That's a cheap, easy tool to implement, and it's helpful. Well, I wouldn't be surprised if we see that. Second is, I wouldn't be surprised if we just see masks more and more commonly, especially during the winter months where we have influenza season. I'm talking years from now, but I just wouldn't be surprised if we see integration of masks into more Western societies. I think that's something that'll last. In terms of deep cleans and wiping and washing and stuff like that, I wouldn't be surprised if some, but not all of this falls by the wayside as the pandemic subsides in the hopefully months, but probably year-ish to come. I think we'll probably see some of those extreme examples of deep cleaning fall by the wayside, but perhaps there might be some lasting legacy where people are just more mindful of what high contact surfaces are and to clean those up, doorknobs and elevator buttons and keyboards. So maybe there'll be some long lasting legacy of that as well. I don't know, just a guess. I'm as curious as you are. I'd love to see how this moves forward. But, as we sort of touched on a few moments ago, we've got, hopefully there's a more health literate and science literate world as a result of this. And people can ask the good questions and people can expect more of their government, of their businesses that serve their communities to really provide a safer environment for them. That might be a lasting legacy that comes from this pandemic.
Dr. Bogoch, thank you so much for breaking that down for us.
My pleasure. Happy to chat.
That's Dr. Isaac Bogoch, infectious disease specialist at the University Health Network and Toronto General Hospital. Some interesting thoughts there. He says there's nothing wrong with wiping things down and being extra careful as long as we're doing all the other things like wearing a mask, distancing, and definitely washing our hands whenever we can. That's it for today. Thanks for listening. This Matters is hosted and produced by me, Adrian Cheung, Saba Aitazaz, and Raju Mudhar. Produced and mixed by Sean Pattinen, and our director of programming is JP Fozo. Our show theme music is by So Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.